Ever get that like weird fluttery feeling in your chest? After maybe one too many drinks or when work has you totally stressed out.
Yeah, definitely.
Well, today on the deep dive, we're going deep into a real medical case all about that. A young guy whose heart just kind of went off the rails.
It's a fascinating one.
We're going to break down what this condition, atrial fibrillation or AFib, is, figure out why it might happen, especially to someone young, and see what the doctors thought was super important in this guy's treatment. So, like, think of it as a cheat sheet to understanding this whole complex thing.
Exactly. We've got this incredible source material. It's like listening in on a conversation between the doctors treating this patient.
Yeah, that's cool. So it's a real behind-the-scenes look.
Absolutely.
Awesome. Okay, so let's get into it. Our case is about a 28-year-old guy named Rohan. He ends up in the ICU, and they diagnose him with new-onset AFib.
New onset, meaning this is the first time he's ever experienced this, which is important.
Right. So he's got this crazy heart rate, like 150 beats per minute.
Yeah.
He's feeling palpitations, dizzy, and a little short of breath, too. So, like, what jumps out at you right away from that? What did the doctors zero in on?
Well, the age, right. AFib in a 28-year-old who's otherwise healthy, that's a bit of a red flag. It's not as common as in older folks.
So it makes you think there's got to be something specific triggering it.
Right. It's not just age-related wear and tear on the heart. There's something else going on.
And Rohan mentioned a few things that might be relevant. He'd been out partying, had a good amount of alcohol, maybe some energy drinks, and he was dealing with a bunch of stress at work.
Ah, okay. So those are all things that can potentially play a role.
Yeah, and it was interesting because the doctors specifically talked about these lifestyle factors. And this actually lines up with some recent guidelines for AFib. I think they were the 2023 HECC-PHRS guidelines.
Yeah, those are the ones.
They emphasize how important these modifiable risk factors are, especially for younger people.
It's becoming more and more clear that lifestyle choices have a huge impact on heart health, even at a younger age.
So let's break down those lifestyle factors a bit.
Yeah.
How can those things actually lead to AFib?
Sure. So alcohol, for instance, it can really mess with the heart's electrical system, the signals that make it beat regularly. When those signals get disrupted, that's when you can get into fibrillation.
Oh, interesting. So it's like the signals get all scrambled.
Exactly. And then energy drinks, those are loaded with caffeine and other stimulants, which can also put stress on the heart, make it work harder, and beat faster than it should. And over time, that can increase the risk of developing AFib.
Gotcha. And what about stress? How does that fit into the picture?
Well, stress triggers the release of hormones like adrenaline and cortisol, which can, again, speed up the heart rate and make it more susceptible to arrhythmias like AFib. It's basically like your body's fight or flight response going haywire.
It's like your heart's on overdrive all the time.
Yeah, and that kind of chronic stress can definitely take a toll on the heart in the long run.
Wow, that's wild. Okay, so Rohan had all these potential triggers. But before jumping to conclusions, the doctors obviously had to rule out any other underlying medical conditions.
Right. Gotta make sure there's nothing else contributing to this AFib episode.
So they ran a bunch of tests, checked his thyroid function, his electrolytes, looked for signs of heart damage, the usual workup.
The standard battery of tests.
Exactly. And everything came back normal. They even did an echocardiogram, which is an ultrasound of the heart, to see if there were any structural problems.
Yeah, that's important to rule out things like valve problems or heart muscle abnormalities.
And the echo was normal too. So basically all signs pointed to what they call lone AF. Can you explain what that means exactly?
Sure. So lone AF basically means AFib that occurs in people who, after all the tests and investigations, don't have any identifiable heart disease or other medical condition that could be causing it.
So it's like AFib without a clear underlying cause.
Yeah, it's a bit of a mystery in some ways, but in Rohan's case, it seems likely that those lifestyle factors played a significant role.
Okay, so no obvious underlying condition.
Yeah.
So what was the next step?
Well, the immediate priority was to get his heart rate under control. It was still way too high.
Still racing away at 150 beats per minute.
Exactly. So they gave him intravenous beta blockers, which are medications that help slow down the heart rate. And luckily, it worked pretty quickly. His heart rate came down to about 85 beats per minute, much more manageable.
Much better. So heart rate stabilized. What happens next?
Now, the focus shifts to getting his heart rhythm back to normal, restoring that regular beat.
Okay, and how do they do that?
There are a couple of main options. One is electrical cardioversion, which is basically a controlled electrical shock delivered to the chest. It's like hitting the reset button on the heart's electrical system.
Oh, wow. So it's kind of like a jump start for the heart.
Yeah, exactly. And it's usually pretty effective at restoring a normal rhythm. The other option is pharmacological cardioversion, which uses medications like flecainide or propafenone. These drugs work by calming down the electrical activity in the heart and allowing it to beat normally again.
So two different approaches, shock or meds.
Yeah.
How do they decide which one to go with?
Well, it depends on a few factors like the patient's overall health, how stable they are, and how long they've been in AFib. But in Rohan's case, he was relatively young and healthy, and his AFib was new onset, so both options were on the table.
Okay, got it. Now, one thing that always comes to mind with AFib is the risk of stroke. How did the doctors think about that with Rohan? Did they put him on blood thinners?
That's a crucial question, and there are specific guidelines that help doctors determine who needs anticoagulation, which is what blood thinners are for. For patients under 65 who don't have any other risk factors for stroke, like high blood pressure or diabetes, immediate anticoagulation might not be necessary.
So they assess the individual's risk, basically.
Oh, exactly. They use a scoring system called the CHA-2DS2 VASC score to estimate stroke risk. And in Rohan's case, his score was 0. He was young, had no other risk factors, so the doctors felt that blood thinners weren't necessary right away.
Interesting. So no blood thinners, but I imagine they stress the importance of preventing another episode.
Absolutely. Prevention is key, especially when lifestyle factors are involved. So Rohan received a lot of counseling on cutting back on alcohol, managing stress, and avoiding energy drinks.
Yeah, it's a good reminder that those things can have a real impact, even in someone as young as Rohan.
For sure. And they also scheduled him for regular follow-up appointments to monitor for any signs of AFib recurrence. It's all about taking a proactive approach to heart health.
So it sounds like the key takeaways here are that even in a young, seemingly healthy person, lifestyle choices can be a major trigger for AFib. Getting the heart rhythm back to normal is the first priority, but the long-term solution lies in tackling those underlying triggers.
Absolutely. This case really highlights how our daily habits, what we eat, how we manage stress, how much we sleep, all of it can have a profound impact on our heart health, even at a younger age.
It's pretty eye-opening to see it happen in someone so young.
It definitely makes you think, right? Like, what seemingly harmless habits that we all have could be affecting our hearts in ways we don't even realize. I think that's something worth pondering. Maybe it's time to look into those things, see what the latest research says about how our everyday choices influence our cardiovascular well-being.
Yeah, that's a great point. It's definitely food for thought.
Food for thought, literally and figuratively.
Exactly. Well, that's all the time we have for today's deep dive. Thanks for listening, and we'll catch you next